I am Dr. Sundus Mehtab Shafee, and with the team of Neurology Made Easy, I'm presenting an introductory session for the Neurology online course. I was waiting for a few more participants, but I think I should start the session as most of you are committed with another online course. So here we go. So before moving towards the proper session, it's important to know that who am I? I'm Dr. Sundus, as I have already told you. So I'm a consultant neurologist and a senior registrar of neurology working in Karachi. I've done my residency from Civil Hospital Karachi under the supervision of my professor, Dr. Naila. And the reason why this course is here, why you should choose the course or why you should participate in the course, there are multiple reasons. When I was a resident, it's not too far away, it was 1 year back. So what I felt was that most of the candidates, not even of internal medicine, but also of neurology and all the medicine related subspecialties, they have some sort of fear or phobia with the neurological examination, neurological history, cases. And what I've recognized or realized is the main thing was about the localization. The important point over here is that all the systems, including CVS, respiratory, abdominal, and all that, you don't need to localize, properly localize the disease. I request every participant to mute yourself. Please keep yourselves muted and your audios stopped. The audios and videos stopped, okay? So neurology is the only field that requires localization. Every time you perform a case, either long or short, the first question that examiner will ask you, either you are a neurology FCPS candidate, MCPS candidate, medicine candidate, or you are going for cases or anything else. The first question that will be asked is going to be about localization. And if you fail to localize the disease properly, you'll fail the whole viva, because this is the main foundation of neurology. If you cannot localize the disease on the basis of history and examination, you cannot give the proper viva, you cannot make the diagnosis, okay? So that was the main theme that, okay, of course, I know you, all of you, of course, I mean, I think 99% or 95% of the candidates are already enrolled in some of the, online, virtual, physical courses all over Pakistan. Then why you should choose this course? It's not compulsory to pass the exam. This is true. आप इसके बगैर भी पास हो जाएंगे, आप किसी भी कोर्स के बगैर पास हो जाएंगे, ठीक है? But what's the need is that if you want to have a quick, comprehensive, and a logical review of the important topics, important long and short case related to neurology with some important theoretical points that will basically help in your viva, localization, differentials, and all that, then you should choose this course, okay? So the main agenda is practice, practice, and practice. Very important thing. Practice makes you perfect, okay? So with the first agenda, I would like to let you know that I would prefer that most of your candidates, like whoever has already registered in my course or who are planning to register, they should consider it as an active participant. It's not about the fees, please. It's about the concept of the participation, okay? I'm going to tell you in a minute that what's the purpose of active and what's the differentiation between active and listeners. But main thing is, if you are appearing in this attempt, you need to be confident enough, you need to be logical enough, you need to be quick and smart enough to examine the patient in a proper time, in a proper way. Other than this, you need to be, the things should be on your fingertips. that, okay, if the question is this, I need to give an answer like that. So this all could happen with a lot of practice. If you don't practice in any course, if you're not an active participant in any course, then you can be successful, of course, and I pray for that. I'm really hopeful for that. But again, practice is more important than just participate as a listener. Of course, as a listener, you will gain some knowledge. You will gain, hopefully, the knowledge, the amount of knowledge you need. But I would prefer that those who can attend as active should attend the course really like an active participant. Okay, the next agenda is time management. Time is key. I know most of the candidates in different subspecialties and internal medicine as well, who have very good theoretical knowledge and grip on theory, who can perform in a very better way, who have done proper neurological examination and all that, but their time management is poor. And that's the main thing. If you know everything, but you cannot perform it within the time limits, then your knowledge will be fruitless. This course will encourage you, motivate, and provide you confidence. Okay, what's the main purpose? The main purpose is hidden in these next 3 or 4 bullets. First is to polish the examination skills. You should know the schemes, the sequence should be on your fingertips. And this course will help you out in this regard. Other than this, you should have tips and tricks to localize, because of course, your mind will have different type of fears. You'll be having multiple thoughts at the moment of examination. So you need tips to localize, okay? You don't need long logics about that. You need quick, logical, and smart replies, because you'll be short of time in exams, especially when you'll be dealing with short case. The most important thing, overcome exam phobia. All these courses are designed to make you in the situation of examination hall, and that's why I'm emphasizing on the participation as active participant, because that will create a situation that, okay, you are in an examination hall, there's a timer going on, and you need to complete your examination and history in particular time, and I'll be the patient, and I'll then perform as an examiner as well. So that will help you in overcoming exam phobia. Another important thing, fluent presentation. This is not, this is a fact. In fact, I mean, if I listen to someone, if I'll hear to someone, and you'll have a conversation with someone who is very much fluent in English, or who have a very fluent language, who is speaking like, without any breaks. So that will impress you. That's true. And this course will help you to, to make your tongue smooth, to have a fluent presentation. But again, please be confident enough that if you have knowledge, if you know the case, if you have positive, smart, logical replies, then you can use any mode of language, okay, in exam. Don't imprison yourself that, okay, I have to speak English and I cannot give the answer in Urdu. It's not fact. But of course, you need to be fluent and quick, okay? Then of course, this course will help you in Viva practice. So who should participate? We have decided, or we have planned the course in a way that 2 types of participants will be there. Active participants will actually be the candidates who will be appearing in exam only. They will perform long and short case. We are not dealing with chokes, okay? We are dealing with long and short case, and I'll let you know about the format in a minute. And then these candidates will perform the case and will answer all the Viva questions. If they fail to do the relevant things, then the listeners get the opportunity to jump in and answer the questions, okay? And listener can be anybody who want to improve their knowledge or who are appearing in exam. Okay, it's a very, I can say, it's a tough time for me to decide the exact timing of the course. I mean, there was a lot of discussion going on about the timings and all that. So this time is tentative, which is on your screens, but the dates are fixed. Okay, inshallah, the course will be within these 5 days, but the timings are flexible. Okay, flexible means that when the registration will get closed, I'll make another group, WhatsApp group of the active and listed participants, and then within those candidates, I'll decide personally that what is the time most favorable or feasible for all of the candidates or most of the candidates. About another query was about the recordings. Okay, I cannot promise the recordings because there may be some you can say 1 minute. Okay, so there may be some sort of interruption in internet, or some technical issues can occur. So I cannot promise it, but of course, on personal request, recordings for a session or 2 can be provided to the registered candidates, which will be valid for another 24 hours. Okay. So what will be the format? Format will be very simple. I've kept the formats in a way that initial 30 minutes will be mine. I'll be discussing the important topics. I'll be discussing the important topics theoretically with all of you guys. I'll be giving like a lecture, okay? And then we'll be dealing with 2 long cases, 2 to 3 short cases, and Viva will be included in evaluation of performance. Okay, one more thing. In my course, please remember, आने का टाइम है, जाने का टाइम नहीं है. ओके, क्लास में एंट्री का टाइम तो फिक्स होगा, जाने का टाइम टेंटेटिव होगा. अगर ये सारी चीजें, सारे गोल्स हम अचीव कर लेते हैं within 2 hours, it's good enough. अगर नहीं होता, तो this is in your benefit that I can extend that session for half an hour or 40 minutes more. Okay, and I think all of you will agree with that because it's more beneficial for you. Okay, these are the requirements. पहले मैंने एक्टिव पार्टिसिपेंट्स के लिए वेब जो है वो कंपल्सरी किया था, but now it's an optional. It's optional because it's for your own